So, talking about a time whenever I felt judged or insecure while being assessed by a doctor, teacher, etc. Well, I can't think of any specific time, but there's been a just a whole host of issues like that over the past few years. Um, Starting in 2019 ish. Um, I've been struggling with a physical health issue since then, and I can't hardly get any of my doctors to take me serious or to do anything much about it. It severely limits me, um, my everyday life. It controls every aspect of my life. I can't hardly focus on my schoolwork, or in meetings or meeting people or anything because the sometimes the pain level is so bad that it's all on my mind. I you know, without having quality insurance and stuff, you can't really do much. And even when I did have insurance, you have copays and all this stuff, and still doctors just don't pay no attention to you. They just write you off and they just make you feel stupid. And it's like I know my body, you don't know what I'm feeling, and but I guess doctors have this complex. A lot of them, medical doctors, they think they know, and you know, I just haven't had any much luck, and I'm still fighting it. Um, I got Gene Medicaid this year, so that seems to help a little bit, but you know, still doctors are so uh, thinned out. It's taken months to get any help, and started physical therapy again for like the third time. Hopefully that will work, and maybe some non uh, overnights, not overnights, but like surgery um, options. Can't think of the name. It's like it's non-surgery, but it is. And it's whatever. But I should be doing something like that here soon too. So I don't know, but it's scary, and it affects my mental health greatly. It has. I've not tried to let it get to me so much here lately, but that was in turn um, why my substance abuse issues kind of took um, control. I've struggled with substances since I was 17, but whenever I started having these physical symptoms, this pain, it just the substance abuse skyrocketed. Because I was just trying to get anything, do anything to get out of pain. You know, Physical pain alone was enough to for me to attempt suicide a few times. Not counting the emotional pain of all the other trauma and stuff that I was going through and all the other stuff and the spiritual pain and all and everything as a whole. Um, uh, I haven't had a whole lot of uncomfortable situations when it comes to my substance abuse. I've largely felt like I've been listened to, and non-judged in that. But it's my physical health symptoms with doctors that I always feel like they're judging me, and make me feel insecure about. Um, but I've also put a lot of inner reflection on my own physical pain, and along with the substance abuse stuff, and like as many as you know, I am in recovery, um, and I'm still working on the physical pain, and I'm not necessarily letting it try to affect me to the point where I am just completely overwhelmed with substances because I realize, okay, these substances, alcohol or, pills or, you know, whatever, I would use cocaine, meth, amphetamines, there was a brief time there. That would work. They would work. They would get me out of this pain for a little while, physically and emotionally, and put me in a place of, oh, okay, I feel okay. But the pain would come back, as it always does, and usually come back tenfold. You know, so I realized that that wasn't doing me any good. And in fact, it's compounding the issue. Um, so I realized that okay, maybe part of my pain isn't going to go away. I think we tell ourselves when we're in active addiction, you know, whether you're dealing with physical pain or emotional pain or mental stuff, that when I feel better, I'll stop using. When I feel better, I'll stop doing this, I'll stop doing that. And I don't think that that will ever happen. I think that we have to step back and learn how to deal with the pain in a better way for it to maybe diminish. You know, um, so that at least that's been the case with me, and I think that's been the case with most everybody that I've talked to about it. So I'm still diving into that, and I'm getting more and more, you know, um, into all that aspect of things. Um, Now, as far as like what doctors have done to try to make me feel comfortable with my physical stuff, some of them they put on a facade, like they care and that they're gonna do this and stuff, but I can usually see through it. Um, more largely nothing but just a number to them, and I think doctors and people in the health field in general, I think they did get into this because they did have empathy and they did want to help. But when we get into these roles, you know, whatever the roles may be, if you're a medical doctor, if you're a teacher, or if you're a social worker or a police officer, whatever, we get so bogged down by the red tape of the stuff and all the paperwork and all the ins and outs and all the people that do us bad and stuff. And so we just get to the point where we're like, okay, whatever, I don't care, you know. And I think that's a systemic issue um, that needs to be addressed, by some sort of paradigm shift or something. I'm not exactly sure, but something needs to happen there because it is most definitely a systemic issue. Um, so yeah, we'll see. I'm hoping. I've come a long way in just in these past 6 months because like I said, I with my physical pain and my substance stuff, I still have some physical stuff, substances. I'm I'm pretty much there, but it's been a lot of self care, a lot of, a lot of, uh, yeah, a lot of help and a lot of, you know, uh, things, and it, yeah, but um, I'm hoping that these next 6 months before graduation that I'll feel even better, um, that I will even become even uh, much farther in my healing journey, and be a completely different person by the time we walk across that stage. That's my hope and goal. Thank you.